Depression is a common mental disorder that causes people to experience depressed mood, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, low energy, and poor concentration. Depression is different from feeling down or sad. Unhappiness is something which everyone feels at one time or another, usually due to a particular cause. A person experiencing depression will experience intense emotions of anxiety, hopelessness, negativity and helplessness, and the feelings stay with them instead of going away. Depression can happen to anyone. Many successful and famous people who seemed to have everything going for them battle with this problem. Depression also affects people of every age. Half of the people who have depression will only experience it once, but for the other half it will happen again. The length of time that it takes to recover ranges from around 6 months to a year or more. Living with depression is difficult for those who suffer from it and for their family, friends, and colleagues. It can be difficult to know if you are depressed and what you can do about it. Signs and symptoms: tiredness and loss of energy. Sadness that doesn't go away. Loss of self-confidence and self-esteem. Difficulty concentrating, not being able to enjoy things that are usually pleasurable or interesting. Feeling anxious all the time. Avoiding other people, sometimes even your close friends. Feelings of helplessness and hopelessness. Sleeping problems. Difficulties in getting off to sleep or waking up much earlier than usual. Very strong feelings of guilt or worthlessness, finding it hard to function at work, college, school, loss of appetite, loss of sex drive and/or sexual problems, physical aches and pains, thinking about suicide and death. Self-harm. If you experience 4 or more of these symptoms for most of the day, every day, for more than 2 weeks, you should seek help from your GP. It leads to depression. Depression can happen suddenly as a result of physical illness, experiences dating back to childhood, unemployment, bereavement, family problems or other life-changing events. Examples of chronic illnesses linked to depression include heart disease, back pain and cancer. Pituitary damage, a treatable condition which frequently follows head injuries, may also lead to depression. Sometimes, there may be no clear reason for your depression, but whatever the original cause, identifying what may affect how you feel and the things that are likely to trigger depression is an important first step. Types of depression. There are several types of depression, some of which are listed below. Mild depression. Depression is described as mild when it has a limited negative effect on your daily life. For example, you may have difficulty concentrating at work or motivating yourself to do the things you normally enjoy. Major depression. Major depression interferes with an individual's daily life, with eating, sleeping and other everyday activities. Some people may experience only one episode, but it is more common to experience several episodes in a lifetime. It can lead to hospital admission. If the person is so unwell they are at risk of harm to themselves. Bipolar disorder. The mood swings in bipolar disorder can be extreme, from highs, where the individual feels extremely elated and indestructible, to lows, where they may experience complete despair, lethargy and suicidal feelings. Sometimes people have very severe symptoms where they cannot make sense of their world and do things that seem odd or illogical. Postnatal depression. Many new mothers experience what are sometimes called baby blues, a few days after the birth. These feelings of anxiety and lack of confidence are very distressing, but in most cases last only a couple of weeks. Postnatal depression is more intense and lasts longer. It can leave new mothers feeling completely overwhelmed, inadequate and unable to cope. They may have problems sleeping, panic attacks or an intense fear of dying. They may also experience negative feelings towards their child. It affects 1 in 10 mothers and usually begins 2 to 3 weeks after the birth. Seasonal affective disorder. SAD is associated with the start of winter and can last until spring, when longer days bring more daylight. When it is mild, it is sometimes called winter blues. SAD can make the sufferer feel anxious, stressed and depressed. It may interfere with their moods and with their sleeping and eating patterns. How do I get help? Talking therapies such as cognitive behavioral therapy, CBT, and some forms of counseling and psychotherapy work well for depression, although you may have to wait to see a therapist on the NHS. You can pay to see someone privately and your GP may be able to recommend someone. Always check that any private therapist is registered with a professional body. There are several different kinds of talking therapy. Your GP can advise you about which you might find most helpful. Counseling gives people the chance to talk through everyday issues that may be causing depression and to develop strategies for resolving them. Cognitive therapy, sometimes called cognitive behavioral therapy or CBT, addresses the way you think and how this can cause depression. It teaches you skills to identify patterns of behavior and thinking that are causing you problems and change them. Psychotherapy can be more intensive than counseling, although people in organizations often use these terms interchangeably. It often looks at how past experience may be affecting your life now, so it may involve delving deeply into early experiences and key relationships. This may take more time, although shorter, more focused ways of doing this have also been developed. Interpersonal therapy focuses on how you relate and behave towards others. It helps you to build a better self-image and communicate more effectively with others. Antidepressants. In many cases, your GP will recommend antidepressants, either on their own or in combination with talking therapies. Antidepressants do work for many people, but inevitably they do have side effects. You can discuss these with your GP. About medication. Medication will not always be the first choice, especially if your depression is mild. There are a number of different types of antidepressants available. Your